Thank you for the preemptive thank you for the preemptive applause. I have a PowerPoint to share, so I'm gonna quick hop over to that. Let's see. And then I'm gonna start my slideshow. Okay. And it's starting it at the very end, which is helpful. I'm gonna try and start at the beginning. All right. Is it showing up for everybody?
Yes.
Okay, excellent. All right, thank you so much. Hi, my name is Jess Draws. I am the regional coordinator for Region 5 of the Opioid Response Network. I'm here to talk to folks today about building substance use resources through regional partners. So just a quick presentation for you today. I even have a little video to wake you up. And I hope that this will lead to many more conversations down the line. We are hopefully, as you'll be able to tell, a great resource that I would love for you to be able to utilize and you and your colleagues. The PowerPoint, I think, is uploaded into the system, so you'll be able to review this at your leisure. But this is just a little disclaimer about how we're funded by SAMHSA, and all of this is made possible due to our grant, which we were actually also recently refunded. I think it was September 26th when we got notification of our renewed funding for the next 3 years. So really happy to be able to continue to do this work. And here is the video. I am going to make sure that my sound is shared because I know that's a typical thing that I forget to do. And okay, I'm gonna play it, but then quick pause it just to make sure that the sound actually did manage to share. So one moment, please.
Communities across the nation
Did you hear that?
Yes.
Okay, excellent. Then we will continue.
are mobilizing to address opioid and stimulant use and the overdose crisis. You can't overcome this alone, but we can, together, and we are. We are the Opioid Response Network, a coalition of 40 national organizations representing more than 2 million people. We serve all 50 states and 9 territories locally through our network of nearly 1,000 professionals working across prevention, treatment, and recovery. For state agencies, organizations big and small, and individuals working to address local needs, we bring training and education to bear on your efforts. We're here to help you help others through evidence-based support, all at no cost to you. For instance, the Opioid Response Network helped the Tribal College in New Mexico join forces with local organizations to develop a culturally appropriate prevention, treatment, and recovery training series for its students. In Rhode Island, we convened corrections staff from 34 states to share how our program had reduced post-incarceration overdose deaths by more than 60% and supported them in their efforts to build similar programs in their home states. In West Virginia, we mobilized to help a clinic incorporate substance use disorder services into their practice, serving a faith-based community. We helped healthcare providers in South Dakota address barriers they face providing treatment services for their patients. We're here to help those on the front lines. So, what are your needs and how can we help? Visit the opioidresponsenetwork.org to learn more and to submit a request for support. The Opioid Response Network, funded by the Substance Abuse and Mental Health Services Administration.
Excellent. Thank you so much for sitting through that. Love the examples they have and also the graphics. Really proud of the team that put that together. So I always look for an opportunity to share it. I'm going to try and go to the next slide. Sometimes when I click, it just starts the video again. So we'll see what happens. Okay, excellent. So just to recap kind of what the video said, we do all of our work with communities. So that is all the way up to the state level and all the way down to the individual level. Literally anybody can submit a request to our network, either like I said, like I've worked with the state of Ohio, I've worked with organizations, I've worked with hospitals, and I've also worked with just individuals. Like sometimes people will come to us and then they'll say like, oh, like I am looking for resources to like continue my education, maybe stuff related to like low cost and continuing CMEs, that kind of thing. And we're able to help them find that type of stuff, or if they're working on like a specific program, that sort of thing. So the resources and technical assistance that they're looking for. Uh, Technical assistance is available to support evidence-based prevention, treatment, recovery, and harm reduction for both opioid use disorders and stimulant use disorders. So we're the opioid response network, but we work across different substances, mostly with opioids and stimulants, but we can help with almost anything. I have a slide in here that says there isn't really a wrong door when it comes to us or our partners. Like if you show up and you say, I need help with this, and I'm like, we're not quite the best person for that, I can still get you to the right organization. So the ORN provides local experienced consultants, like I said. We accept requests for education and training, and each state has a designated team, which I'll talk a little bit more about. Like I said at the beginning, some folks might have not hopped on yet, but we are funded by SAMHSA, but our leadership it consists of the Addiction Technology Transfer Center Network, the American Academy of Addiction Psychiatry, and also the Columbia University Department of Psychiatry. And then we are a very large network made of 40 plus organizations, adding new organizations all the time. So I just highlighted a couple down here, and I'm also going to talk about some that I think would maybe be relevant to y'all as resources. The Region 5 team is three technology transfer specialists, which includes myself, and then one regional coordinator, which is also me, so little dual role there. And then we also have two Indigenous Community Response Team TTSs who work specifically with tribes both in the Great Lakes region and in the Mountain Plains region. And they do excellent work. So Region 5 is the same as the HHS region. So that's Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. And any requests that come into the network where you list your location as Ohio are coming directly to me. So if you have questions related to Ohio, I'm the person. We are based out of the Center for Health Enhancement System Studies at the University of Wisconsin-Madison. So I'm coming to you live from Madison, Wisconsin today. We are in the College of Engineering along with the Great Lakes Addiction Technology Transfer Center. And I'll say a little bit more about them as well as they're one of like I said, they're part of our leadership and also they're one of the best resources out there, I think, for training and education. I just wanted to highlight a couple folks that are also part of our consultant network, which is kind of a large way that we kind of um, uh, field requests is if you can submit a request to our network and then we try to match you with somebody who has similar expertise or expertise in the area that you're looking for. So these are just a couple folks in Ohio, and I also wanted to highlight the top two are treatment providers, but this bottom one, Anita Bradley, she is my favorite recovery consultant to work with. So if you are looking at your program and you really want to assess it from like a recovery perspective, she's probably the person I'll connect you with. She's incredible. The founder, president, and CEO of the Northern Ohio Recovery Association out in Cleveland. So yeah, lots of folks. We're not just limited to people in Ohio. Like we try to keep the the folks we refer you to local, but I could also like you can tap into the expertise from folks throughout the region and throughout the country. I wanted to highlight a couple partners, like I said, that I think might be relevant for folks. The Providers Clinical Support System is one such organization. They have an extensive catalog of trainings that you can access. They also host clinical roundtable discussions and have a mentorship program. And they also have a discussion forum where if you make an account with them, you can log in and ask questions, that kind of thing. Another partner we have is, I think it was previously California Bridge, and I believe now it's just Bridge. But they do all type of work related to getting MOUD into emergency departments. And they do incredible work where you can get individualized assistance from them, or they also have live and on-demand trainings that you can access. Lots and lots of folks are really excited about this resource, and we're one of the ways that you can access them for free. Another resource I wanted to highlight was the National Harm Reduction TA Center, specifically because I think like something they do that is really interesting is if you are facing in your city or your town or just in your county legal and policy barriers to implementing any type of like harm reduction services, this program, like they will do their best to help work you through how to address those barriers. So they're equipped to do that, and ready, willing, and able. And if you uh, go into my slide deck post program, that request assistance button, I believe, will take you right to their website. I just added that in there so people could get to it easily. And then last but not least, the Great Lakes Addiction Technology Transfer Center. Like I said, also based at UW-Madison with chess within chess and with Niatex. The region also includes the same HHS region as ORN, and Isa Velez, my colleague, is the state coordinator for Ohio. Um, Again, a huge training and events calendar. I'm also on their weekly meetings, and they always have something super interesting going on, often that has CMEs attached to it. I also wanted to highlight the healthyknowledge.org, which is not run specifically by Great Lakes, but it is a resource if perhaps you have a colleague that isn't in addiction medicine, but they want to like get a head start, like kind of learning the basics, that kind of thing. There are some courses within the Healthy Knowledge platform that can help them get started. And we also have a newsletter and some other products and resources that I think like I often utilize like when people come to me and they're like, oh, like I'm looking for this, that, and the other thing. Like one of the first places I look is in this products and resources catalog. All right. I think actually I'll pause quick here for questions if we want. And then I'm gonna talk a little bit more about how to request technical assistance, which honestly, it's like kind of the more practical part, so that might answer some of the questions that people have.
One of the questions I might have, and I'm really intrigued by the bridge program in California, where it
Hmm.
looks like they're inducing MATs in a emergency department and then finding longitudinal providers. Is that
Hmm.
basically the
Hmm.
model? Uh,
Hmm.
so is that something that you do matchmaking with and help facilitate meetings, or is that a resource that we just access ourselves? How does that work? Or are you going to get into that now?
I'll get into it a little bit now, but yes, essentially it is like kind of a matchmaking. When folks come to us, I essentially look through my catalog, look through my network to try to find the best possible consultant who could be one of our partner organizations like California Bridge. And then sometimes we work in concert, so we together will kind of handle the request and like set up meetings, talk through things, that kind of thing. And other times I will just hand off a request to an organization, do a warm handoff, and they kind of like take over from there. But yeah, California Bridge is really great. I feel proud specifically because there was, I think it was 2 years ago now at this point, but there was an organization that wanted to work with Bridge specifically, and I was able to like facilitate that connection and facilitate. That partnership. Like California Bridge was not part of the opioid response network, but I was able to connect them with leadership and now they're on board. So I really love that program. All the people there are incredible. And yeah, I they also just got like refunded and everything. So they're incredible and I highly encourage anybody to look into what they're doing, even if you're not in the emergency department. They're awesome. Any other questions? Okay. All right. I will get into it. Here's our little cheat sheet of things that we can do for you. So, like I said, we provide TA to anyone, and all of our services are always free. So, there is absolutely no harm, no foul in submitting a request to us. Like I said, even if we can't help you, we will find someone that can. We do tr free trainings on issues related to all across prevention, treatment, recovery, harm reduction. We also do things on DEI and stigma if you're interested in that, want that kind of training for your staff. We do short and long-term consultation, help organizations with strategic planning, and provide those evidence-based materials and resources. Things that we can't help with, just to help folks get an idea of that. We can't help you seek or write grants or get funding. We can't help hire. We can provide you with links to free and low cost resources, but we can't like individually train like or like send you to a conference specifically, that kind of thing. We also don't do any certifications, and while we can't create materials, we can advise on the creation of materials. So if you contact us and you're like, I want to put together like this curriculum or this packet, we can't create that for you, but we can say, here's some best practices, here's what we know, like here's how to go about it, that sort of thing.
Ooh, I would say if we are doing a like an infographic to share our echo. Is that something that we could submit to you after we finish it to make sure
Mhm.
it's clear and right for the right audiences?
Yes, yes, absolutely. We could
Awesome.
definitely help with that.
Thank you.
hmm So like I emphasized previously, there is no wrong door. If you're not sure that we can help you, but you're like, I need help and I am looking for something or anything, you could always submit a request to the network. If you're in Ohio, it will come directly to me and I'll try to get you what you need. If you're based in another state, if you like share this resource with a colleague or something, it'll go to another technology transfer specialist. But all of us are ready and willing to help you in whatever capacity we're able to. I have a little bit of data for Region 5 as far as the Opioid Response Network goes. Like I said, we did just get refunded, so I'm waiting on some more current data, but we got about 200 requests over the course of a year, with 20% of those just being finding re relevant materials and resources, and then smaller amounts resulting in trainings, handoffs, or requests being fulfilled by hosting multiple consultation sessions. Um, a lot of the requests we get into, because it is so easy to submit a request to our website, sometimes people don't realize that like a real person is going to get back to them within 24 hours. And they're like, oh, like I actually wasn't really ready to like begin this like quest that I'm going on, or I don't have the institutional support that I need. So sometimes requests are closed out a little early, before we're able to like really provide any like training or consultation. But with those folks, like I said, the door is also always open. So if you submit a request and then you're like, actually, I don't have time to work on this right now, we can always close it out and then you can just submit a new one whenever you're ready. And yeah, that's yeah, part of how we work. I did want to provide this example of a request that I worked on, just like as just good info for things that we have helped out with before. I'm actually still working with these folks out in Worcester. There was a training coordinator for an integrated healthcare organization that wanted a bunch of trainings for her team. So she was like, I would love them to be educated on MI, on SBIRT, and also on ASAM levels of care. And I was like, great. I can do two out of those three things. I think ASAM levels of care is proprietary, so I just linked her to where she could find that. But I have trainers specifically that are educated on both providing full MI and SBIRT education. So we set up some trainings. She trained her staff, and these were multiple full day in-person trainings. And then afterwards, we did 6 months of virtual check-ins with her staff just to practice MI, answer any questions that they had, that sort of thing. So that was like a year or two ago, and then we closed out that request, and she just recently submitted a new one so we can kind of train the next set of her staff, new folks that are coming in to also work on or be educated in MI and SBIRT. So yeah, that's like something that we're able to do, provide that type of training for your staff. And I think that's really wonderful. How you submit a request, the practicalities of that, like I said, you just go to our website. In the upper right-hand corner, there is this giant orange button that says submit a request. You fill out the form, which I believe is like a Google form or a Qualtrics. And then if you're in Ohio, like I said, you wait for me to get back to you. I will typically just send an email and say, hi, thanks so much for submitting a request. Would love to chat with you on the phone. And then we set up a meeting just to talk through more what you're looking for. And I can get a better idea of how I can help you out or how I can connect you to the resources that you're looking for or need. Um, Nearing the end of the presentation, just a couple things to stay in touch. These links will be available, like I said, in the PowerPoint. The ORN has a newsletter, and also the Great Lakes ATTC has a newsletter, both of them full of really wonderful resources. highly recommend subscribing to them if you're always on the lookout for new education opportunities. And then here's a couple links to our Facebook, our website, and our LinkedIn for the Opioid Response Network. And yeah, that kind of concludes my presentation, short and sweet. I am now I'll have a Q&A. I'm also going to check the chat just because I figure there might be some questions that came in there as well.